Hey Connie,
Hey Christian.
I was wondering if you could perhaps tell these prospective first-year students something about your Pathways program and what you hope to do this summer.
All right, well, the Pathways program is awesome. So that was one of the major things that got me to come to UMass. It's a really unique opportunity, and it's perfect if you're into serving multicultural populations in the US and abroad. And I know there are a lot of people interested in that are coming to medical school. So I will be going to Ethiopia, which is going to be awesome. And the great thing about the Pathways program is you get funding to do this. So you get money in your hand to go wherever you want, whether you want to do language immersion or you want to work on a public health study or shadow physicians, anything you want, you've got money in your hand. And you've got this huge network with Mick Godkin, who's the head of the program, who can set you up with programs all over the world.
What do you hope to do in Ethiopia?
So in Ethiopia, I'm going to be working on a public health study of maternal health and HIV transmission, and I'll be shadowing physicians and living with a host family, trying to learn a little bit about Ethiopian culture, so dabbling in a little bit of everything.
Awesome. Thank you.
All right.
So ladies, what has been one of your highlights of your first year at UMass thus far?
There's so
Christian,
many.
yeah.
I'd have to say probably the spring break trip to the Dominican Republic that we went on.
Definitely.
Yeah.
The two of us were on the trip along with, how many?
I think it was about 25 students.
20. So there were first year medical students, second year medical students, and then second and third year nursing students.
Yeah, and it was really awesome to get to interact with nursing students because we almost never see them. So to get to know them in that context was awesome because they know a lot and they're awesome. And we also got to interact with faculty members that we also don't see all that often, so that was pretty cool too.
Yeah, they were really good about helping us out with our interviewing skills. So every day for 5 days, we went to these places called betes, where Haitian immigrant workers who work in the sugarcane fields live, and they don't get very much medical care. So between two groups, we would see around 100 people a day, so that's 200 total people a day. And the nursing students would kind of help us figure out what to ask. We would be paired with one, or you'd be paired with a physician. So that was really cool to get that opportunity.
Yeah, and if you know Spanish, it's a good way to brush up on your Spanish, or Creole. If there are any people who speak Creole out there.
Yeah, I speak a little French, so I was able to pick out a couple French words, but...
Yep. And we also got to have some other experiences that we might not be able to have here in the US at this time. Like, I got to scrub in an OBGYN surgery, and I wasn't just like watching. I actually got to help retract and do things, so that was pretty awesome.
I saw a teratoma.
I saw a teratoma. Awesome.
And then I was able to go on the PAP bus, which is basically the women's health bus that they set up while we're in the clinic setting. And so some people did pap smears. I didn't get a chance, but that's definitely available for you to do while you're there.
So yeah, it was awesome. We saw over 200 patients a day, got to meet people we wouldn't normally meet within our school, and got to know people better within our class, and it was awesome.
And we got to go to the beach, so
Yes.
It was a nice balance during our spring break for work and play.
Thank you. Bram Keller, big second year on campus. Please share with us what you did between the summer of your first and second year of medical school.
Sure. I arranged to go to Malawi in southern Africa. I wasn't part of the Pathways program or anything, but I've done a lot of traveling and was kind of interested in getting a healthcare perspective from a developing country. Spoke to Mick Godkin, who organizes a lot of those things, and they were able to come up with funding for me, which was awesome. So I got funding, went over to Malawi, worked in a rural village, kind of doing a lot of hands-on medicine, living in the village, learning the language, and I really had a wonderful time. And tell those students who kind of want to get involved in international opportunities, UMass is definitely the place to be.